Greetings from Health Angel Solutions once again. I want to talk about thyroid pain today, as well as some conditions that may cause it. Perhaps more importantly, though, is what you can do about it. Let's get started by briefly discussing neck and thyroid pain and discussing whether or not they are serious. Hashimoto's thyroiditis, thyroid cancer, hypothyroidism, and other general thyroid diseases are all quite prevalent. But what's noteworthy is that thyroid discomfort is really uncommon in terms of symptoms and presentation, and is almost always abnormal. The question is, what other symptoms might you have if you are also experiencing thyroid pain? Because if you have thyroid pain, it indicates that something is happening inside your thyroid gland, and it's almost always going to cause other symptoms or are related to your thyroid itself. Well, I shouldn't say almost always because it always is abnormal, okay? But if you have true thyroid pain, then it's an abnormal finding. Some of the most common conditions that can present with this we'll go over in just a minute. Therefore, the way that pain is felt is usually the result of an inflammatory process or something that has been traumatized, either internally or externally, and it has released inflammatory cytokines. Your body responds by causing a small amount of local inflammation, which is similar to the bruise pattern you see if it occurs elsewhere in your body, such as on your muscles. However, the same thing can occur in your thyroid gland, or rather, it can happen. But if it does, there's a very high likelihood that it will also interfere with your body's ability to produce thyroid hormone. And you're going to have symptoms whenever you have an excess or inability to produce thyroid hormone. Usually, thyroid pain is linked to these symptoms, and it's usually caused by a transient rise in thyroid hormone that gives patients the impression that they have a hyperthyroid condition. Other symptoms that patients may experience in addition to thyroid pain include anxiety and fatigue, palpitations in the heart, hot flashes, irritation due to diarrhea, tremors, or shaking of the hands, and perhaps rapid weight loss are the most typical symptoms of thyroid pain. However, they don't happen to everyone. On the other end of the spectrum, if you have thyroid pain and let's say you've damaged your thyroid gland, it can release too much hormone due to the inflammation, but it can also prevent your body from producing enough thyroid hormone. If that occurs, you may experience some of the symptoms of hypothyroidism, which include temporary weight gain. Well, they're the exact opposite of the symptoms we discussed previously with hyperthyroidism. So I'll go over them anyway. Fatigue or low energy, hair loss, constipation, dry skin, depression, as opposed to anxiety. Menstrual irregularities and an overall feeling that you're not feeling like yourself are the symptoms that typically accompany thyroid pain. Now let's talk about what actually causes thyroid pain. The most common cause is subacute thyroiditis, which is what your doctor will likely diagnose you with if you visit them with thyroid pain or if they suspect you have it. Thyroiditis is simply inflammation of the thyroid gland. We've already discussed this condition a little bit. Subacute thyroiditis is defined as being halfway between acute and chronic thyroiditis. In the medical community, the term acute refers to something that happened very quickly and that you are experiencing the side effects right now. For example, if you felt like you were punched in the stomach and your stomach hurts, that would be considered an acute sensation because it happened right away and you are feeling the effects. On the other hand, the term chronic refers to something that is low, slow, and progressive, and means that you have been experiencing these symptoms continuously for a long time. This would be something like irritable bowel syndrome, where the kind of pain you experience is a chronic symptom. One of the most immediate symptoms of a punch to the stomach is pain. Though both conditions are technically pain in the stomach, subacute thyroiditis refers to an illness that lies between the acute and chronic phases, causing inflammation of the thyroid gland. Usually, this is caused by an infection of the thyroid gland, which is significant because not many people have discussed thyroid gland infections. Most often, these infections are caused by viruses that tend to clear up on their own. However, when an infection occurs in the thyroid, it can be extremely painful, making it comparable to strep throat. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. Even though strep is different in that it is a bacterial infection, you can imagine how painful it is to get an infection in that area, especially in your throat. Now imagine that same process occurring in your thyroid gland when you have strep throat, as most people have probably experienced it. It is extremely painful, even to the touch, and even if you just tap your neck, it will hurt. This is known as subacute thyroid disease, and it is the most common type. It's usually a virus, and it usually appears and disappears on its own without any medical intervention. However, it could also be bacterial. However, it may also be fungal, so you should have it checked out as soon as possible. Secondly, there is another inflammatory condition that can cause thyroid pain: Hashimoto's thyroiditis. As you may recall, thyroiditis is the inflammation of the thyroid gland. However, in this case, the cause is an autoimmune disease, which indicates that your body is attacking itself. You would assume that this would hurt if your immune system was attacking and killing your thyroid gland. And it just really isn't the case in reality. Most patients with Hashimoto's thyroiditis don't experience any pain at all. In fact, when they do, it's usually hypothyroidism or hyperthyroidism symptoms. They hardly ever experience thyroid pain, even though their thyroid can enlarge and can even be seen through the skin on their neck. However, this is a potential cause of thyroid pain. So if you're on therapy, you should definitely get checked out to make sure it's not Hashimoto's thyroiditis. The third, this is why I listed lymphadenopathy as number 3. Lymphadenopathy is a term used to describe enlarged lymph nodes, some of which can become painful. There are lymph nodes that also go directly around and near your thyroid gland. I've included this because, although you may think that your thyroid is the source of your pain, it could actually be your lymph nodes. There are lymph nodes throughout your neck, but in particular, there is a chain of lymph nodes that runs directly down near the thyroid gland and also on the lateral sides of your neck. Though there are ways to distinguish this, I want to include number 4 as well. Number 4 is another possible cause is thyroid cancer. Again, don't let this scare you because thyroid cancer usually does not cause any pain in the thyroid gland. These are different from the thyroid gland. If you're experienced and understand what they feel like, you can actually touch these things in there, and they're usually tender right when you touch them. So like they're not tender around the area, they're directly tender on node itself. There are some extremely rare types of cancer that grow too quickly. These cancers can occasionally cause pain, damage to skin tissues, and a very poor prognosis. Fortunately, these types of cancer are extremely rare. As for common thyroid cancer, which affects about 90% of people, that type of cancer won't cause pain, though it can cause lymphadenopathy. To make matters more complicated, even though cancer-related lymph nodes can sometimes enlarge, they usually don't hurt. That's just a way that it sort of goes limp down. If your lymph nodes hurt, that's usually an indication of an infection, which can kind of go hand in hand with subacute thyroiditis. Postpartum thyroiditis is the 5th and last condition, since it develops after pregnancy and is typically the result of the mother's body trying to suppress the immune system to prevent the body from attacking the fetus while it is dancing in utero. You can really think of this as a variant of Hashimoto's thyroiditis. Occasionally, this can lead to changes in the immune system, which can increase the risk of thyroiditis or inflammation of the thyroid gland. I won't spend too much time on it, but if you're in the postpartum period, which lasts for up to 12 months after giving birth, and you just so happen to touch your neck, or you find that your neck is enlarged or tender, that may be an early sign that you have postpartum thyroiditis. Again, this is never normal. Most women who have postpartum thyroiditis don't experience irate pain, but it can occur just like it can occur in Hashimoto's thyroiditis. So what do you do? Well, the course of treatment really depends on what caused it. Some of these conditions are very difficult to treat, so let's just quickly review. Subacute thyroiditis usually goes away on its own. If it doesn't, you'll probably need to get serious treatment with antibiotics, antifungals, or something similar. There isn't truly an acute treatment for Hashimoto's thyroiditis. Instead, it requires ongoing care. However, to give you an idea, it's not something you can just take immediately, like a supplement, and it will magically go. Adenopathy of the lymph, similar thing. It all depends on the etiology, which may have been cancer. However, that usually doesn't hurt, and it might be the result of an infection that exists, but eventually goes away. So consider that thyroid cancer treatment. Depending on the type of thyroid cancer you have, it might involve surgery to remove the thyroid gland, which is uncommon, or it might involve chemotherapy and radioactive iodine. Postpartum thyroiditis also tends to go away on its own, making treatment challenging. However, that might be your best course of action. Another thing to consider is your diet. Avoid foods that cause inflammation. Certain foods can cause inflammation in the body and can also cause gut dysfunction. All of these things may be slightly causing inflammation in you, so you can look into them. You can also look into supplements like the ones I mentioned above. In some cases, you may also want to think about taking non-steroidal anti-inflammatory drugs or NSAIDs for a short period of time. Naproxen and ibuprofen are a couple of these. These are usually available over the counter, but they work by blocking the same pathway that certain supplements use to cause numbness, but in a different way. In other words, they kind of prevent your body from attacking itself or initiating and escalating that inflammatory cascade, so you can use them as well. If you do experience tired pain, though, you should visit your doctor. You should be aware that you need to be evaluated for all of these conditions. It's fairly simple to obtain some basic tests that will enable them to determine what is wrong and why you are in pain. In conclusion, understanding the causes of thyroid pain is essential for effective management and treatment. Whether your discomfort stems from conditions like thyroiditis, goiter, or nodules, recognizing the symptoms early can lead to timely intervention and better health outcomes. Remember, it's important to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan tailored to your specific needs. For those dealing with thyroid pain, lifestyle changes such as a balanced diet rich in essential nutrients, regular exercise, and stress management techniques can significantly improve your overall well-being. Additionally, appropriate medical treatments, whether hormonal therapy or anti-inflammatory medications, can help alleviate symptoms and restore balance to your thyroid function. We hope this video has provided you with valuable insights into the causes and treatment options for thyroid pain. If you found this information helpful, please give us a thumbs up and share it with friends or family who might benefit. Your support helps us reach more people and spread awareness about thyroid health. Don't forget to subscribe to Health Angel Solutions for more informative content on health and wellness. Hit that notification bell so you never miss an update. If you have any questions or experiences to share about thyroid pain, leave them in the comments below. We love hearing from you and engaging with our community. Thank you for watching, and remember, your health is your greatest asset. Take care and see you in the next video.